Hey everyone, so let's talk about UTIs and overactive bladder, the two diagnoses that I see the most of in my practice. And November was just the World Bladder Health Awareness Month. And so I feel like this is perfect timing to talk about this stuff. So, what's the relationship between UTIs and overactive bladder? Does one cause the other? Is one a sign of the other? And the answer is not really. Although the symptoms of overactive bladder and UTIs can sometimes mimic each other and confuse people, okay? And so let's talk about that a little bit. If you have a UTI, your bladder is infected. And if your bladder is infected, it's probably inflamed and sort of angry, okay? And then, so those patients that have UTIs will very often have symptoms of overactive bladder. They will have an urgency to urinate. They will have frequency to pee. They pee every 30 minutes or so, or every hour. They wake up a lot at night to urinate. And they may even leak urine if their bladder is super, super sensitive. However, after the UTI is treated and the bladder heals, the bladder usually calms back down and becomes sort of normal again, for whatever normal is for you. People that have chronic overactive bladder sometimes think they have UTIs, but in reality, they don't. They just have overactive bladder. Sometimes it's better, sometimes it's worse, but very often there is no infection. It's just the bladder that's very sensitive and tends to want to pee a lot or get an urge to go a lot, all right? So the two conditions are actually completely separate. One does not really cause the other, but the symptoms sometimes do overlap. So that's a little bit of bladder awareness for today. I'll see you guys later.